So the major disconnect between the clinical situation and the investigative situation is that in patients it's very difficult to eliminate CLL cells, whereas when the cells are taken from the patient and put in a in vitro setting, the cells die very rapidly. So it indicates that the cells have some way of living in a patient that is not necessarily recapitulated in the culture setting, and that disconnect is an indication that there are influences that take place within the patient that are not present in the artificial situation. And these are interactions between the CLL cell and the microenvironment. Both cells within the microenvironment as well as soluble factors like cytokines and chemokines within the patient or microenvironment. So what we're looking at is trying to model those interactions in animals by using primary cells from CLL patients. So what we do is to take cells from patients, transfer them into animals that have defects in their ability to recognize foreign cells. So they do not have the ability to reject the cells, and they allow the cells to essentially grow in the mouse as they might grow in a culture. The advantage being that the mouse provides, at least in for some situations, those microenvironmental influences that we cannot provide in the culture. And essentially what we find is that there are major influences provided by T lymphocytes. In fact, for CLL cells to grow in the types of mice that we use, T lymphocytes are an absolute requirement. If they are not there and activated, then CLL cells cannot grow. We've also identified that the microenvironment is important even in the presence of T cells to allow the cells to respond to the T cell. So for example, if the CLL cell is present in the spleen in conjunction with activated T cells, then the CLL cells divide very vigorously and increase in number. However, the CLL cells are in the peritoneal cavity, a totally different microenvironment than the spleen. They cannot divide, even though they have in their close contact T cells that are dividing. So there's a major disconnect between the spleen and the peritoneal cavity. Exactly why that's happening, we don't know, and we hope to be able to study that soon. And finally, what we found is that the myeloid compartment within the blood cells of a CLL patient, or even a normal individual, do not engraft well in these animals. So one way of getting around that problem is to use animals that have already been pre-engineered by others to express human cytokines that support the development of myeloid cells. And we've used that actually to show that one can set up an experimental system to then test the microenvironment using those animals. So I think what we want to do now is to try and, for example, when dealing with the issue of the peritoneal cavity versus the spleen, one microenvironment versus another, do they mimic what we see in patients? So for example, in patients, CLL cells divide in very restricted areas called proliferation centers, and cells that are not within those proliferation centers do not divide. So are we able to use this difference between division in the spleen versus lack of division in the peritoneal cavity as ways to understand what happens actually in the patient? So that's objective number one. And objective number two is then to try and use this way of getting a better engraftment of myeloid cells using a different murine recipient to test the influences of myeloid cells on CLL cell growth and differentiation.